When the pandemic hit this country, Congress took action to prevent states from removing Americans from Medicaid coverage. But with the end of the pandemic health emergency, states have now begun that process of clearing their rolls of people who aren't eligible to stay on the program. But as Rachel Scott reports, millions of Americans are mistakenly being removed despite still being eligible. She takes a look at the families caught in the middle in our series, Through the Cracks.
For 5-year-old Penelope, appointments like these have become all too familiar. At such a young age, she's had more visits to the hospital than birthdays, never going longer than a few weeks without sitting in an exam room.
So my understanding is that she's here because she's having staring episodes and they've been seizures in the past, and we wanted to confirm is she still having seizures or not. Is that correct? Right, and then she's scheduled for 48 hours.
Her mother, Jillian, there by her side, longing for the day this won't be their reality.
Oh, you're doing so good.
Penelope was born with classic galactosemia, a rare genetic metabolic disorder that can cause lifelong health complications.
I would spend every dollar if I had to make sure she was okay, you know, because she's just such a fighter.
You're being so good today.
For this family in South Florida, Medicaid is their lifeline, reducing the cost of Penelope's medications.
This first medication she takes for seizures. This is about $1,000.
But in the first week of May, Jillian and her husband Rocky say they found out their daughter had unexpectedly lost her health care coverage. Just as states began to roll back pandemic-era protections, removing millions from their rolls.
When did you learn that Penelope lost coverage?
My occupational therapist texted me and said she's no longer on our Medicaid list. She's been dropped. And it was just like, this has to be a mistake.
What was going through your mind? I eventually had a complete breakdown. Like the day you called, I was crying all day. It was just so overwhelming. It's so defeating. My whole life is taking care of her. I'm her caretaker. And I felt like a bad mom. Like, oh my, like she'll get less care because she doesn't have insurance. And that's the truth.
Job.
I'm so grateful for Medicaid because of,
We couldn't do it.
we couldn't do it. We couldn't do it.
It would be impossible.
Jillian is a registered nurse, but she says the insurance process has been difficult to navigate, spending hours on the phone trying to get answers.
Do you know why Penelope was kicked off of her coverage?
Ultimately, I don't. They didn't even tell me that I was dropped. I didn't, and I went through all of my letters to see where I was dropped, and there was absolutely not a single letter in my profile online.
You've gotten no answer.
No answers whatsoever.
Across the country, federal officials estimate at least 1.5 million Americans have lost their Medicaid coverage since April. For the last 3 years, states were barred from kicking people off the program. That's all changed now that the pandemic-era rules have been lifted, and it's sparking confusion across the nation. In Tallahassee, Liz Adams says her 7-year-old son in remission for leukemia was dropped with no explanation.
We went 6 months back into our emails and our spam, and there was nothing. There was no notifications from them at all. Emotionally, it's been taxing, to say the least.
In Gravette, Arkansas, Allison Corder says by the time she found a mailed notice from the state, her and her son were already uninsured.
I've moved since then. I've gotten a million letters in the mail, and it's just really confusing what they're wanting from me.
And in Clay County, Florida, Marnie Harvich says her 13-year-old daughter, Cassidy, who relies on a ventilator to breathe, was almost kicked off of Medicaid prematurely.
It's insane. Not only are you fighting to keep them insured, you're fighting to keep them alive.
These families, all part of the 15 million Americans who could lose coverage as states begin tightening the rules. The problem, with such a big undertaking, Medicaid officials estimate half of those Americans could be dropped by mistake.
7 million people who are eligible to receive Medicaid could still actually lose their coverage. Why is that happening?
So that is one of the pieces I mentioned that is of paramount concern to us, and why it's been a how do we move heaven and earth moment over the past 2 years. We should not accept that as success or how we think about what we're trying to achieve is. We need to make sure we do everything federal, state, the private sector, other partners to keep everybody eligible enrolled.
Daniel Tsai is a director at CMS, the Centers for Medicare and Medicaid Services, the federal agency overseeing the process. He says procedural errors, misnotices, and confusion are all in part to blame for eligible recipients losing coverage. CMS says it has been pushing states to streamline the process.
And a lot of the strategies and options we've been putting on the table are options for states to help be able to do more upfront automated renewals.
Are some states resistant toward that change?
There's more to do. And indeed, some states have taken us up on every option and strategy that we put on the table.
For the states that are not following these guidelines, what action is being taken?
If we find that, even with the best intentions or not, if the federal rules are not being followed, folks should expect us to take and use every lever at our disposal.
At least 25 states so far have started disenrolling people from Medicaid. Florida dropping 303,000. Arkansas, some 110,000.
This is a really heavy lift. We see mistakes are made. Families don't get the letter. They don't understand the letter. They have a hard time getting help.
In an op-ed in the Wall Street Journal, Arkansas's Republican Governor Sarah Huckabee Sanders says, "We're simply removing ineligible participants from the program to reserve resources for those who need them and follow the law." But advocates and experts are concerned that potentially thousands, especially children, are slipping through the cracks.
We know that the vast majority of children who may lose coverage during this process will remain eligible for Medicaid.
Florida's Department of Children and Families says it has developed a robust outreach campaign, including up to 13 direct contact attempts to recipients who do not submit a timely application. While the state declined to comment on Penelope's case due to privacy concerns, a spokesperson maintained everyone that is removed from Medicaid receives a final notice informing them the reason for termination. But Jillian and Rocky say they are still looking to the state of Florida for answers. After several weeks of calls and working with an advocacy group, they were finally able to get their daughter Penelope back on Medicaid, at least until the end of the review process.
Penelope now is covered through March of next year. Is that temporary relief? Do you fear that she could still lose her coverage in a year?
You are waiting for the other shoe to drop. I don't trust it, because if this can happen, it can happen again.
Right, it's just very simple questions and still don't have answers. No one still knows why. I mean, someone denied it. They don't know why. No one's held accountable.
An absolute nightmare for those parents and so many families. Our thanks to Rachel Scott for that eye-opening report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.